Ladies and gentlemen, good morning. I'm here representing the governor who was supposed to be with us today, but he couldn't make it because there were some urgent duties in Nairobi that he had to attend to at the Council of Governors. Today, we are gathered here to commission this medical waste microwave equipment to help in shredding medical waste generated from our health facilities across the country. The national government, through the Ministry of Health, procured this microwave plant from AMPCO Belgium in the Republic of Belgium. The warehouse was built with the support of the county government of KAKAMEGA to the tune of approximately 3.5 million Kenyan shillings. Maybe a little bit of the history of this medical waste plant. This was a plant that was we acquired sometimes in 2014. So it took us quite some time before we put up this plant. And we are grateful to the Ministry of Health because at one time they were threatening to take it away from us. But we pleaded with them and they agreed to it. And the first time when we started building up this building, actually people were wondering what kind of waste plant was, and they thought it was a very, very big housing. But now, if you go inside there, at least I think that's okay. You have that entrance, a truck can be able to enter into this building, then come out through this. At one time we were concerned about the heat that will be generated, because if you have this, we were worried that it might be so hot there that people could not be able to go in there. But as if when it's running, there isn't much heat. At least there's enough ventilation. So the preparations for official commissioning of this plant were preceded by training of one operator. We have an operator here. We have 5 biomedical technologists and 7 public health officers. The training was facilitated by the supplier of the machine and the focus on operation and the maintenance aspects. The plant can shred and microwave 400 kilograms of waste per hour, and it can clear approximately 60,000 kilograms, which is the equivalent of 60 tons of waste per month, if its operation is at optimum. At that rate, this machine can be able to handle all the waste that we get in the county. And it can even operate, it can treat even the waste from the surrounding counties. Because 60 tons, KAKAMEGA, we may produce less than 2 tons of waste per day. So at 60 tons, we can be able to do actually from all the surrounding counties, Vihiga, Bungoma, Busia, and even the Siaya. This resultant waste is also non-infectious because after it has been treated at a very high temperatures of about 121 degrees centigrade and staying there for 1 hour, all the microorganisms are killed. If this waste were to be treated outside the hospital in line with the NEMA 2012 guidelines on hazardous waste management, would have cost the health facilities within the county that 2 million annually. If we're supposed to do this outside, it would be 32 million. So we are saving quite a lot of money. Operationalization of this plant is a game changer in reducing the ozone depleting gases such as carbon, fluorocarbons, CFCs, furans, dioxins, carbon dioxide, which is common with the incineration practices which are found within KAKAMEGA County health facilities. Ladies and gentlemen, health facilities in KAKAMEGA generate an average of about 3 tons, and I think it's less than even 3 tons of delinquent waste daily. For this reason, therefore, there has been need for treatment of this waste in a manner that complies with the Public Health Act, CAP 242, laws of Kenya, and the National Environment Management Authority, NEMA Act of 2012. I'm therefore happy that the cooperation between the Ministry of Health and the county government enabled us to set up the plant that we are commissioning today to effectively handle medical waste from our facilities. All health facilities within KAKAMEGA County, both government of Kenya and private, will be required to bring medical waste for treatment to this facility before disposal.
It is
the county is developing a health care waste policy that will provide a legal framework in operationalization of waste treatment and disposal, and will include charges, disposal, maintenance, and human resource. The county government is committed to ensure the sustainability of this project. However, there is need for further deliberations and public-private partnership engagement to enable smooth running of the facility through funding and resource mobilization. I'm told that another unit will soon also be installed here, because this one is only dealing with the biodegradable and non-biodegradable plastic things. But we have some metals like syringes that will have another unit that will be installed soon to handle that, because this one cannot be able to handle that. The unit that will be able to break the syringes and the metal materials into very tiny particles separately, that they will also be sterilized, and those can be reused in some other way. That should come up anytime. As I conclude, I take this opportunity to ask the supply of the microwave to deliver the needle crusher that he has not yet delivered as required in the agreement. I just told you that we should be able to get this. I will not end my remarks without expressing my gratitude to the national government for their support. Somalia and Mokaya, for your support towards ensuring the installation and the operationalization of this plant. I also want to thank county officials who have worked tirelessly to ensure the success of this event. With those few remarks, I declare the waste microwave officially open. Thank you. But before I end, I think you have seen today's paper. There's something in today's paper that talks about COVID. And I want to emphasize and tell you that COVID is real. As of yesterday, as of today, there are 29 deaths that have been reported because of COVID. And that's why we are also telling the residents of KAKAMEGA everywhere, please be very careful, because COVID is there. I understand there's the new variant that's called the Delta variant. It has affected quite a number of people, and we get quite a lot of visitors, so we need to be very careful. But particularly, I want to talk about what appeared in the paper today. They say, I think there's a story there that is saying, part of the media, that patients are being asked to bring cylinders. That's not true. You cannot be asked to bring a cylinder. A cylinder to do what? You can't. The problem that we are having is that we have 2 units that produce oxygen. The pressure flow from these 2 units that have a combined capacity of 500 liters per minute, the pressure is not enough. And we have realized that. That's why, as a county, we have ordered for another unit that is already now the port of Mombasa, and it is being brought to KAKAMEGA, that will have a high flow pressure of oxygen. Because you see, a cylinder, even if you put in oxygen, it is not enough. It can't produce the pressure that is required. So we'll need a unit, we have a unit that will help to be able to pump the oxygen at high pressure. So that's what we have in Mombasa, and this unit is able to produce 1,000 liters per minute of oxygen. It's fairly a big one, and it will also be able, you can put that in the cylinders and also be able to serve the other counties. But we want a unit that has high pressure, that can pump at that. We are not asking, and again I want to emphasize, we are not asking patients to bring cylinders. We know that patients do not have oxygen cylinders. So that story is not right. Let it be corrected. As of today, yesterday, our ICU was full. So today, we have 18 patients. We have 18 COVID patients. 3 are in the ICU. Yesterday it was full. 3 are now in the ICU today. 2 are on ventilators. 7 are on high flow oxygen supply. 6 on normal units. They are not on ventilators. They are not on oxygen. They are not in the ICU. But as we get more and more patients, our facilities are getting full. And as the governor explained the other day, we are also getting patients from the surrounding county governments. We cannot stop it from the surrounding county governments, because if our people also become sick, they are in Kisumu, they cannot be referred here. They can be taken to Kisumu Hospital, Bungoma, Busia, and the others. So the patients that we have here may not only be from KAKAMEGA, but some of them are from the surrounding county government. So let us be patient. Let us know that COVID is there. The COVID is killing. It's real. 29 people have left us, and maybe more others, because these are the ones that have been tested. So let us please be very careful. Let us leave this place. That's why we have invited very few people today. We didn't want a crowd here, because we don't want KAKAMEGA to be a hotspot for transmission of COVID. So, ladies and gentlemen, thank you very much for listening to me, and let us be aware that COVID is with us. Let us not be the next victim tomorrow. Thank you very much.
So right now we are signing official handover documents, which will now transfer this facility to Kakamega County. The media registration photos, we request that kindly though at the background, you kindly face the cameras. Thank you. Thank you. The professor's signature is a little bit complicated, so we'll have to give him some time to finish. He'll be followed by Mr. Michael Mwanya. And he's done. Thank you. The contractor is also appending a signature to the document to symbolize commitment towards completion and the supply of the equipment as required. Dr. Brenda, just a minute, kindly press forward. Thank you, thank you. Asante sana, thank you so much.